Hello, thank you for watching the video. This may seem sudden, but have you ever experienced your feet getting unusually cold or wounds taking longer to heal? There's a saying that people age along with their blood vessels. As people get older, everyone experiences arteriosclerosis to some extent. When you hear about diseases caused by clogged blood vessels due to arteriosclerosis, what illnesses come to mind? Heart attacks, where the blood vessels in the heart get blocked, or strokes, where the blood vessels in the brain get blocked. Actually, along with those two, there is another serious and life-threatening disease, arteriosclerosis of the blood vessels in the legs. The legs are so important that they're often called the second heart. When arteriosclerosis in the legs progresses and the heart can no longer send enough blood, one day your legs will start to cry out in pain. And if you don't notice it early enough, in the worst case, you might even have to have your leg amputated. Some may think leg arteriosclerosis isn't serious, but consider this data. The 5-year mortality rate is... There is also data showing that arteriosclerosis in the legs has a higher rate compared to the average for colon cancer and breast cancer. So, this time, I'll briefly explain how to detect SOS signs from your legs early and how to prevent arteriosclerosis. I'll also introduce an easy way to check if arteriosclerosis in your legs is progressing while watching this video. Please be sure to watch until the end. The aorta branches into blood vessels that supply both legs. These are called peripheral arteries. The blood vessels in your legs are farthest from the heart and become thinner as they extend. Thinner vessels are more likely to clog from arteriosclerosis. When that happens, oxygen and nutrients can no longer be supplied to the cells in your legs, so various symptoms will appear. This is called peripheral artery disease or peripheral artery disease. What symptoms occur when leg blood vessels are blocked? They can be mild or severe. Let's review the Fontaine classification, which defines the stages. In stage 1, the mildest symptoms are coldness and numbness in the legs. As blood flow decreases, you may feel colder, but this is hard to distinguish from naturally cold feet or chill from air conditioning. As blood flow worsens, symptoms like leg numbness appear, marking a clear change from before. These symptoms are getting worse. Could something be wrong? This may indicate progressing arteriosclerosis. Please consider visiting your hospital, internal medicine clinic, or cardiology department. Many people with diabetes have foot numbness from nerve damage, making pain hard to feel. For those people, detection tends to be delayed and the condition can become severe, so please listen carefully to what I'm about to say. Check your feet as I'll explain. Using both of your hands, slowly touch both of your feet from the toes, following along the shape. At that time, compare the warmth of both feet. If only one of them feels unusually cold, if that happens, you could develop arteriosclerosis in your legs. Now, the symptoms of the second stage are called intermittent claudication. It sounds like a difficult name, but it's actually simple. When you walk, your legs go numb, so you end up having to take frequent breaks. In order to walk, you use the muscles in your legs, so you need a lot of oxygen and nutrients. But with arteriosclerosis, nutrients can't be delivered properly, so when you walk, you don't get enough nutrients and symptoms appear. Numbness and pain are experienced differently by each person. After you start walking, about 5 minutes later, you start to feel numbness, cramps, or pain. But if you rest for about 10 minutes, it usually gets better. There are many people like that. If a specific joint in the leg hurts, we consider a different illness. Intermittent claudication can occur in people with back issues as well as those with arteriosclerosis in leg arteries. Compressed nerves in the lower back can cause numbness while walking and lead to a need to rest. It's easy to tell the difference. When you're exercising in a forward-bending posture like riding a bicycle or pushing a shopping cart, you don't have symptoms. People like this are more likely to have intermittent claudication from the lower back. The reason is, when you bend forward like this, it creates more space for the nerves in your back. So the symptoms often get better. It can be a bit confusing. If you go to the hospital and get checked, you'll find out easily. So please consider seeing a doctor. Now, let me introduce a self-check to confirm the blood flow in your legs. Please take a look at this image. There is an artery called the dorsalis pedis artery running through your foot, so by touching it, you can feel the pulse and check the blood flow. If you can't feel this blood flow, your leg arteriosclerosis may have progressed. Checking is simple. Please trace the bone of your big toe upward as shown in this image. Then move slightly toward the index toe side and place 2 fingers there. That's where you'll feel the pulse of the artery. Feeling a throbbing pulse there indicates blood flow to the foot is maintained. If you're not used to it, it can be hard, but not feeling it doesn't mean something's wrong. The posterior tibial artery is a more accessible location. Here's an image of it. Try touching just behind the inner ankle bone. This is also a place where you can feel the artery pulsing, so if you can't feel the artery here, it might mean there's a problem with the artery in your leg. There may be a progression of hardening here. For people with severe swelling or those who are overweight, it may be difficult to feel this area, so it's important to make a habit of touching it regularly. Whenever you remember, try feeling this artery and check if it's clearly harder to feel than usual. This way you can detect any abnormalities early, which is very important. This is the third severity level of leg arterial sclerosis. Pain at rest means you feel pain even when you're not doing anything. This type of pain is usually hard to notice during the day when you're going about your normal activities, but symptoms tend to appear at night when you lie down and raise your legs. The reason is simple. During the day when you're up and about, your legs are down, so gravity helps blood flow reach your legs more easily. However, when you lie down and raise your legs, you lose the help of gravity, making it harder for blood to flow to your legs, and symptoms are more likely to appear. So if you feel more comfortable lowering your legs even while lying down, you might have this condition. You might have advanced arteriosclerosis in your legs. At the second stage, symptoms appeared when you were walking or exercising, as your legs became deficient in nutrients. If arteriosclerosis progresses even further, symptoms will appear even when you are at rest. In other words, your legs will be in a state of oxygen deficiency all day long. If you leave this condition untreated, it could become irreversible, and you may be forced to have your leg amputated. If you have these symptoms, you are already at a stage where treatment is necessary, so please consider seeing a doctor immediately. By the way, for the first and second stages, treatment is usually done with internal medicine and medication. As I just mentioned, if it progresses to the third stage, a bypass surgery may be performed to connect the narrowed parts of the blood vessels in the leg. There's also a treatment called stenting, where a stent is placed in the narrowed leg blood vessel. A wire is inserted and then a metal mesh is expanded. We sometimes expand the vessel, but since these treatments can strain the body, we do so only when necessary. It's important to detect it early before it progresses to that stage. Now, what occurs when it reaches the fourth and final stage? What symptoms appear? Ulcers and necrosis can occur. Those sound scary, don't they? An ulcer means that the tissue deep under the skin gets damaged and forms a deep hollow. Please take a look at this image. The tip of the toe, see how it's hollowed out? That's called an ulcer. And necrosis, as the kanji suggests, is a condition where the tissue is damaged and has died. The foot turns black, and in some cases it becomes mummified, turning black, drying out, and gradually getting thinner. Those kinds of symptoms appear. If it gets to that point, the tissue is completely dead, so it has become necrotic. Bacteria can enter those areas and cause infections, so amputation is often needed. And when it reaches the third stage, you can often tell by the color of the foot. What happens to the color when the blood flow in the foot gets worse? That's right, since the redness from the blood disappears, it turns white. Compare both feet and check every day to see if either one has turned white or changed color. If some of your toes are completely blue and also feel cold, please consider seeing a doctor. Now, what can you do to prevent such frightening symptoms and arteriosclerosis in your legs? I'll briefly introduce some simple methods that you can start using today. The first preventive method is foot care. This helps prevent arteriosclerosis in the legs. More importantly, it's crucial for preventing serious symptoms caused by arteriosclerosis. As arteriosclerosis in the legs worsens, blood flow decreases, slowing wound healing and making even small injuries problematic. Bacteria can enter and cause an infection there, and the bacteria can multiply, leading to a serious infection. That's why you should take care of your feet on a daily basis. When blood flow in the legs is poor, they tend to become dry. For example, your heels can crack like this. When that happens, bacteria can easily get in, so be sure to apply moisturizer to areas that tend to get dry on a daily basis. Check your feet for injuries. This is the second way to prevent arteriosclerosis in the legs. Exercise helps you develop what's known as collateral circulation. Even if the blood vessels in your legs become blocked, new blood vessels can form to bypass and compensate for the blockage. This is called collateral circulation. It's said that this is promoted by exercising. It's also said that 2 to 5% of people over 70 have peripheral artery disease, which is advanced arteriosclerosis in the legs. So I really hope you'll develop an exercise habit to help slow its progression. The second prevention method is to quit smoking. Smoking is the biggest enemy of arteriosclerosis in the legs. People who smoke have a 3.8 times higher risk than those who don't. However, there is also some hopeful data. It is said that people who have been able to quit smoking for more than 20 years have the same risk as those who have never smoked at all. Therefore, quitting smoking is considered effective no matter when you start, so please think about reducing the number of cigarettes you smoke or quitting altogether in order to walk through life on your own 2 feet. Here's the fourth method of prevention. It is to prevent diabetes. Some people may wonder if there is a connection between arteriosclerosis in the legs and diabetes, but actually diabetes is a very well-known risk factor for arteriosclerosis. And as I mentioned earlier, people with diabetes can develop numbness in their legs due to nerve damage, and they may not feel pain. Many people struggle to recognize leg arteriosclerosis symptoms. People with diabetes are more likely to get infections, including foot infections. Check your feet daily and keep them moisturized. And let's also pay attention to the early symptoms of diabetes. This is about the early symptoms of diabetes. I will provide the video in the description and on the cards, so please be sure to check it out. The fifth way to prevent arteriosclerosis in the legs is to have regular checkups. In fact, it's said that 40% of people with arteriosclerosis in the legs or peripheral artery disease have no symptoms. That's why, as I mentioned at the beginning of the video, there are actually as many as 40% of people who don't show any symptoms at all. By the time you notice it, it's already advanced, making early detection hard. That's why it's important to regularly check your legs and notice any changes. If you suspect something is wrong, get regular checkups. As per peripheral artery disease guidelines, people with diabetes or kidney disease, people over 50 who have a history of smoking, and people over 65. If you fall into any of these 4 categories, it's recommended to have an ankle-brachial index test once a year. Do you know what an ankle-brachial index test is? The test is simple. Please take a look at this image. It's a test comparing blood pressure in both arms and legs, taking just 5 minutes. The ankle-brachial index is the value you get by dividing the blood pressure in each leg by the higher blood pressure of your 2 arms. Typically, blood pressure in your legs is higher than in your arms, but if arteriosclerosis develops in your legs, blood flow is restricted and leg blood pressure drops. The blood pressure in your legs is higher than in your arms. In other words, an ankle-brachial index over 1 and up to 1.4 is considered normal. If it goes over 1.4, it means the blood vessels are stiff. It's also said to be evidence that arteriosclerosis is progressing. If this ankle-brachial index test falls below 1, in other words, if the blood pressure in your legs is lower than in your arms, lower blood pressure in your legs indicates arteriosclerosis in your leg arteries. Watch out for a range of 0.9 to 1. If your value falls below 0.9, it fits the diagnosis of peripheral artery disease if there is an abnormal result in this ankle-brachial index test. In that case, we use a contrast agent to view leg blood vessels. We'll consider more tests. What do you think? It's just the leg blood vessels, but they're still important. And the fact that arteriosclerosis is progressing in these leg arteries means that arteriosclerosis is also progressing in the heart and brain. Since blood vessels are connected throughout the whole body, it's only natural. When you walk, your legs go numb, and when you rest, they get better. An experiment gathered 100 people with those symptoms. After following them for 5 years, only 5 of them ended up having to have their legs amputated. But believe it or not, out of those 100 people, 30 had passed away. What does that mean? 75% of those 30 people who died had suffered from cardiovascular diseases like heart attacks or strokes. People with advanced leg arteriosclerosis often have worsening arteriosclerosis in their heart and brain too. So, this means that arteriosclerosis in the legs is not just a symptom limited to the legs, but it's also important for early detection of arteriosclerosis throughout the whole body. That's why, as I introduced in the video, try touching both legs or feeling the blood vessels in them. And also check the color of your legs and see if there are any wounds. Doing these things will not only save your legs, but also prevent your blood vessels from getting clogged or ruptured in the future. It's also important for preventing diseases. And when it comes to the causes of arteriosclerosis, It's high blood pressure and diabetes. Lowering blood pressure with diet and lifestyle changes, not just medication. I've also posted videos about these methods, so please check them out from the description below. And please also check the description for a video about how to detect diabetes early. Let's review the symptoms that develop as arteriosclerosis in the legs worsens. Symptoms range from mild coldness or numbness in the legs to intermittent claudication, where leg numbness or pain occurs while walking and improves with rest. Those are the symptoms I introduced. And at the third stage, pain in the legs appears even when you're at rest, especially at night when lying down. As for the symptoms in the final stage, the fourth stage, I introduced that deep wounds called ulcers can form on the legs, or the tissue can completely die and turn black, a condition called necrosis. And as a way to check your feet, I mentioned touching both feet from the toes to see if there are any differences between the left and right, visually checking for wounds and checking the dorsalis pedis artery and posterior tibial artery. Make it a habit to regularly check the blood vessels in your feet and watch for any changes. I introduce such methods, and if you ever feel that something is wrong, you can easily get it checked at the hospital. You can get tested by comparing the blood pressure in your arms and legs. A test called ankle-brachial index, you can screen for problems at an early stage. As for treatment, in the early stages, you can take medication to thin your blood or take medicine to lower your cholesterol. And if the condition progresses, you may need a procedure called a leg bypass, where the blood vessels are rerouted, or a treatment where a wire is inserted into the blood vessel to widen it with a stent. And even with those treatments, sometimes nothing can be done. Sometimes leg amputation is unavoidable, so early detection and prevention are crucial. Hospitals, by their structure, receive medical fees when they treat illnesses. It's often hard to offer disease prevention advice in outpatient settings, and even when provided, it rarely benefits the hospital financially. However, the most important thing is not treating an illness after you get sick, but rather detecting it early or preventing it before it happens. At YouTube Medical University, I will share clear and responsible information as an active physician. I would be truly grateful if you could subscribe to the channel so you don't miss the next video. I had these symptoms in my leg and got this treatment. The doctor told me this. Please let me know about those things in the comments section, and it's fine to hit either the like button or the dislike button. If you rate this video, I'll use your feedback for the next one. Well then, let's meet again in the next video.